Your school has just experienced an earthquake or other major emergency incident, and you have a number of injured students. You're a member of your school's first aid team. How do you decide which student to treat first? How do you know which victims need to be treated right away and which ones can wait for treatment? Hi, I'm Jill Barnes, and just like you, I'm a classroom teacher in Los Angeles Unified School District. Today, you'll see how first aid teams operate and the methods they use to evaluate the victims of a disaster.
Can you squeeze my hand?
We will demonstrate the process known as triage. The word triage comes from the French word to sort, and that is exactly what this process does. It sorts all the victims into groups so that the most critically injured victims can receive prompt treatment. As a member of the emergency response team for your school, you want to always do the greatest good for the greatest number of victims. During a disaster, your team may be overwhelmed by events and have many more victims than team members. You know that you have limited resources, and you want to make sure that you use them wisely. First, let's take a moment to review the emergency plan for your school and remember how it's developed. Every school in the Los Angeles Unified School District has a Safe School Plan. Volume 2 of that plan is a standardized template for all schools to use as they respond to emergencies. By law, every year, each school in California must form a school safety planning committee to update their Safe School Plan and to make sure the plan meets the needs of all the school stakeholders. As part of that preparation process, a team of teachers and staff is identified as the first aid team. The School Safety Planning Committee should find staff members with the appropriate training and skills to be on the first aid team. While everyone on the school staff is encouraged to have a current first aid and CPR card, it is essential for the members of the first aid team. In the event of a major disaster, it is critically important that schools account for all students and staff. Let's review what should happen when there is a major emergency at a school. When the disaster strikes, the school administration will decide if the school response should be to evacuate to a safe assembly area or to use the school buildings to protect the students and staff. If the emergency dictates that the students move to a safe location away from the school buildings, such as a fire or earthquake, then the teachers and students will conduct a building evacuation. This is the same procedure that is regularly practiced during a standard fire drill. If the emergency is caused by an earthquake, everyone immediately goes into duck cover and hold. All students and staff should be under a table or chair holding onto the furniture leg, protecting their head and neck from flying objects, away from windows and bookshelves that can be a source of flying debris. Doorways are not considered safe areas because swinging doors have been known to hurt people who take refuge in the doorway. When the shaking stops, everyone does a quick self-evaluation to check for injuries, and the teacher will ask, "Is everyone okay?"
All clear, come on up. Is anybody injured? No.
Injured students are identified and assessed. The teacher will check to see if the exit route to the assembly area is clear and direct students to carefully exit the room and proceed.
Okay, well, we need to evacuate and go out to our spot on the field. Line leaders, please go ahead and go out. Everybody else in class, take your things and follow your line leaders. Okay.
Injured students who can walk should do so. Non-injured students can assist injured students and students with specific needs. Students who cannot be moved because of injuries should be told that help will be directed to them immediately. The classroom teacher should always work to do the greatest good for the greatest number of students without endangering anyone. When exiting the classroom, the teacher should leave the door open and unlocked, unless there's a fire near the room. The teacher can use whatever marking system the school has in place to show there is someone left in the room. Every teacher should have a buddy teacher who will check on them, and a go kit of personal emergency supplies. When the teacher and students arrive at the assembly area, the students should go to the designated place on the field. Any injured students should be escorted or helped to the first aid station, and the teacher must report the status of all students to the assembly area command post. Once the teacher accounts for all students and has delivered them safely to the assembly area, then he or she can turn responsibility of the class over to a colleague and begin their assignment on the first aid team. The Safe School Plan directs schools to organize their response to an emergency by using the Standard Emergency Management System. SEMS is the management system for emergencies used by police and fire departments. It stipulates that one person, the incident commander, will be in charge of the emergency response. The incident commander, most likely the principal, has 4 chiefs that report in with specific areas of responsibilities: operations, planning and intelligence, logistics, and finance and administration. The first aid teams fall under the authority of the operations chief. The teams take their directions from the operations chief and report back to that same person. Operations will relay any information to the incident commander. The first aid team has supplies in the emergency bin that they can use to treat the injured. The question is, who do they treat first? Do they treat the victims in the order that they find them? Or by who's crying the loudest? How does the first aid team decide who is the most critically hurt? To triage or assess a group of victims, the first aid teams need to use specific criteria in a specific order. The criteria for triage evaluation are communicated by the victim tags that are used to identify victims. It will take less than a minute to identify and tag each victim, but it will provide you with a strong evaluation and a good starting point for treatment. You can order triage tags from the district warehouse using commodity code 345-32-48278. The tags have a string so that they can be attached to the patient. They also have 5 labels that can be removed to flag a patient's condition or to track what ambulance or hospital they were sent to. As you look at the tag, the most important part is the perforated labels at the bottom that say deceased, immediate, delayed, and minor. Labels at the bottom are removed to show the patient's current condition. The labels are also color-coded, and you may see fire departments move patients onto tarps of the same color to sort the victims by the severity of their injuries. The victims are sorted using 3 measurable criteria: their respirations or breathing rate, the heart's ability to pump blood called circulation or perfusion, and finally their mental status. This can be simplified by thinking about evaluating the patient's airway, if they are bleeding badly, or if they are in shock. It might be the victims who appear badly hurt may in fact not require immediate treatment. With limited time and resources, it is important to treat victims in the right order. The goal is to give priority treatment to those most in need who will benefit the most. This system is not difficult to master and very straightforward. You do not need advanced medical training to do it. The triage process for a group can be done, if necessary, by a single trained individual. The first step is that the person has to have on all the protective equipment needed for handling untreated patients. As with all emergency medical activities, the responders must protect themselves from being infected by blood or body fluids from the victims. This would include putting on gloves, masks, and eye protection. The triage person or triage officer will also need a rescue ventilator mask, a watch with a second hand, a pen, and a supply of triage tags. To begin the process, the triage officer stands in a safe location where the victims can see and hear and says in a loud voice, "Anyone who can walk needs to come to me for treatment."
All right, kids, if any of you need help and can walk, come with me to the green tarp, please.
As the victims come to the triage officer, they are each given a victim tag that marks them as being minor. They are directed to some specific location for victims that have minor injuries. Because they can walk and understand simple directions, they have shown that they are not badly injured. They will be evaluated after more critical patients have been helped, and then they will be treated and watched, and then re-evaluated to make sure that their symptoms do not become worse. The remaining victims now must be triaged or sorted to find the ones with the injuries that need immediate treatment. The triage officer starts by going to the closest victim, checking the victim's respiration rate or how fast the victim is breathing. Severe injuries and shock can cause victims to have abnormally high rates of breathing. If the victim is breathing more than 30 times a minute, the triage officer should tear off the bottom two labels on the triage tag, leaving the red immediate label on the tag, and put it on the victim. That victim should then be taken by the search and rescue team to the treatment area for immediate treatment. The triage officer then moves to the next victim. If a non-ambulatory victim has a respiration rate that is less than 30, the next vital sign to check is perfusion or capillary refill. This is a good indication of how much work the heart is doing. Look at the victim's hands and find a fingernail. Press on the fingernail or palm until it loses color and then let go. If it takes more than 2 seconds for the fingernail bed or palm to return to normal, the triage officer should tear off the bottom two labels on the triage tag, leaving the red immediate label on the tag, and put it on the victim. One cause of poor capillary refill may be uncontrolled bleeding. If the triage officer sees that the victim has a bleeding wound, they can direct the patient to apply direct pressure to the wound and reduce the rate of bleeding. That victim should then be taken to the treatment area for immediate treatment. The triage officer then moves to the next victim. Let's assume that the next victim has a respiration rate that is less than 30 respirations a minute and capillary refill is less than 2 seconds. The third indicator is mental status. Give the victim a simple command such as, squeeze my hand.
Let's see your hand here. Can you squeeze my hand here? Good.
And check for an appropriate response. If the victim is disoriented and cannot follow simple, direct commands, the triage officer should tear off the bottom two labels on the triage tag, leaving the red immediate label on the tag, and put it on the victim. That victim should then be taken to the treatment area for immediate treatment. The triage officer then moves to the next victim. Let's do a quick review. Any victim that is breathing faster than 30 times a minute, takes longer than 2 seconds to return color to their capillaries, or cannot follow simple direct commands are labeled immediate. These victims are displaying signs of shock or traumatic injury. They need to be the first ones seen by the first aid team and the first ones sent to the hospital. If the triage officer comes to a victim that cannot move but does have a respiration rate below 30, does have capillary refill rate faster than 2 seconds, and can follow simple directions, the triage officer should tear off the bottom label on the triage tag, leaving the yellow delayed label on the tag, and put it on the victim. That victim should then be taken to the treatment area for treatment. The triage officer then moves to the next victim. Now we come to the most difficult element. If a victim is not breathing, what do? Gently reposition the head of a non-breathing victim to open the airway, just the way you were taught in your CPR class. See if this allows the victim to spontaneously start breathing on their own. If the victim does start to breathe, continue with the triage evaluation. If the victim does not start to breathe on their own, they are labeled deceased. This is a very difficult decision, but your job is to make sure that valuable time and resources are not spent on a victim that cannot be saved. Let's review the process. Every victim will be evaluated using 3 criteria: breathing, perfusion, and mental status. Victims that can get up and walk to a treatment location are categorized as minor. Any victim with a breathing rate of more than 30, a perfusion rate of more than 2 seconds, or the inability to follow simple directions are labeled immediate. Remember, any breathing victim that is unconscious is automatically labeled immediate. All other non-ambulatory victims are labeled delayed. Once the victims have been triaged, they go directly to the treatment area. Victims in each group need to be watched and periodically reevaluated to see if they're getting better or worse. When the paramedics arrive, they should be taken to the immediate patients first, because these are the victims that need to be treated and transported first. Deceased patients are moved last and taken to the morgue only if they will be seen by others. They are to be handled following the Mass Fatality Management Guidelines in Appendix D of the Safe School Plan. Let's take a moment to practice the triage procedures. Imagine that you are the triage officer at your school during an event with many injuries. The ambulances have not arrived yet, and it's up to you to decide who needs immediate treatment. Your first victim is awake and alert with a good pulse, but is breathing 41 times a minute. How would you tag this victim? Immediate. Your second victim complains of an injured leg and cannot move. Her respiration is 20, her capillary refill takes 1 second, and between the sobbing, she can tell you how she got hurt. How would you tag this victim? Delayed. The next victim has a bad for CERT, Community Emergency Response Training. This class offers excellent training for all citizens on how to prepare for emergencies. I'm Jill Barnes for the LAUSD. Thank you very much for paying close attention to this important video.